admit a few more people. And I'm going to share my screen. There, can everyone see that? Whoops.
No.
No, okay. Didn't work.
No, I didn't see anything pop up.
Sorry.
There we go.
Sorry about that.
There we go.
All right. I think we're in business.
Yeah, I can get that. Get this. Hello, everyone. Oh, I've got somebody else to admit here. We're going to get started here. Todd and I were just talking about how Kirsten is running through the airport in Atlanta right now. She was really hoping to be able to make this meeting, but Todd from LeadingAge National is with us, Todd Adams, and we're blessed to have him with us today to talk about advocacy. He has a lot of experience on the national level, and he will be with us later in January here in Nebraska to talk to us as well. So we're so glad to have him. So I'm going to get us started though and just do a few things, go over a few things for us here in Nebraska first. Of course, today's our pre-visit discussion. We have an event on January 22nd, which is a Monday from 4 to 7. That's at Eastmont here in Lincoln. So there's going to be a couple hours. Todd will be there. We will have Kent Rogert, our lobbyist, there. He will be speaking. Kirsten will be speaking. And then we'll have an hour from 6 to 7, just a social hour. So we would love to see all of you there for that. And then the next morning, Tuesday, the 23rd, is our breakfast with the senators. And that's really where we need your help. We'll be talking about this a little bit later, but we really need you guys to reach out to your senators. We have had some RSVPs, so we will have some there, plus somebody from Senator Fisher's office and Senator Ricketts' office will be there, but they are much more likely to come when they hear from constituents. So please, please, please reach out. We will talk more about that. So yes, advocacy in action. This is our theme we're using in 2024 for really emphasizing making a presence really during the session here in Nebraska. So of course, we're going to talk about a little bit of how to find your representative. Most of you probably know, but I'm just going to review real quick some different places you can go to do that, the importance of this, and then extending that invitation, like I said. So here is, yes, some different pages. You guys, yeah, this is looking for your federal representatives, your senator, your House representative as well. You can search by zip code. You can put in your address. They try and make it as easy as possible, of course. Then I also put in this link. Whoops, why did that just happen there? I just moved my mouse. The link at the bottom I put there, it was for the Nebraska, is to the Nebraska legislature. So you can go there to find your senator. It's pretty easy to Google that, but I just thought I'd throw that one in there. We always have that link and information how to find your senator on our weekly updates that we send out, those emails. So, and here is the state of Nebraska laid out by legislative districts. So I actually can send out these slides if it would be helpful to anyone. And that would show, it's a good way to see who your representative is, and easy to access that. And I'll also send out the recording. So, but that's there. And so, yes, our advocacy for this, we're going to be preparing a document that actually we will give to you guys on the 22nd. That you will have. It's information for you, but it's also something that you can give to your senators. It's going to be laying out kind of the LeadingAge Nebraska, what our position is, what the issues are, and we want it to be helpful to you and to the senators to keep them informed, because some of these senators, they really don't know what's going on in long-term care. And we need to keep them informed. We need to inform them, keep them informed, and keep telling them over and over and over, as many times as you can. So, and it's going to provide some great background information and will really be a conversation starter. So if anyone has questions, feel free to jump in, by the way. And one of the things we really want you to do when you're talking to your senator is, and Todd may cover some of this as well, but it's really important to tell your story. So talk about your residents, talk about those you serve, talk about the rising costs and the strain on the budgets and impacts that you feel would be really meaningful, or things that we need to do that would be really would act in meaningful change, and telling those stories during those individual meetings with senators. After our breakfast on the 23rd, you will have an opportunity. We're going to walk over to the Capitol, which is just about 3 blocks away. You're going to have an opportunity to talk to your senators. You are welcome to set up appointments with them ahead of time. We actually ask that you do that, so you can meet with them, tell your story, talk about what's important to you. But you can also, of course, have an opportunity to talk to them at that breakfast as well, if you invite them. So we definitely need to make sure that they hear from you, even if they hear from you by email, and they hear from you by a phone call, and they hear from you, the more times they hear from constituents, the better. So also, the affecting change, look for action alerts from LeadingAge, both from Nebraska and from national, that those will be coming periodically to notify you of key issues that are up for hearings, or things that are being actively reviewed by the legislature. And during those times, we need to really put pressure on senators to tell them what we want to see happen and how to impact change. So that's just a few things that we have that we've been looking at here in Nebraska. And like, this is just a pre-visit, kind of a quick overview, covering what we're going to be covering, just teasing what we're going to be covering on the 22nd. So yes, and there's the information on our breakfast on the 23rd, 7:30 to 9:30. The Lincoln Community Foundation building is downtown. It's on the information on our website, but it's about 3 blocks. It's right on Centennial Mall, about 3 blocks north of the Capitol. So, and then of course, please call your senator, email your senator, set up visits to their office. Even if you can't get your senator, meeting with with their legislative aide. Their aides are usually in contact with the senator intimately every day. So just meeting with them and passing on your concerns to them is very, very beneficial as well. So we really are pushing you guys to set up those meetings. They like to hear from us as an association, and that's great. But hearing from the constituents from their district is by far just has the loudest voice. And now I'm going to turn this over to Todd with LeadingAge National. We're so glad that he could join us, and I will let him take over and introduce himself and talk a little bit more about what he has prepared.
All right. Well, thank you, Natalie. And it's really just a genuine pleasure to see you virtually. Look forward to being with all of you, hopefully, on the 22nd and 23rd. So looking forward to that. My name is Todd Adams. I am the Director of Health Legislative Affairs at LeadingAge National. And just a little bit about me. I work very closely with our policy team to affect legislative change in Congress. We have a very robust and responsive policy team. They're fantastic. I've been here for a little over a year and a half. So not that long comparatively to where I used to work, and I'll get to that in a second. So I work very specifically and primarily on issues that impact skilled nursing facilities, assisted living. I also work on some of the related issues. Obviously, workforce is a huge one. We just brought on a new director of workforce policy. We're super excited to have her. She comes from Congress like I do, and is sort of in the process of getting started, and she's been fantastic. She was actually at annual meeting. So if any of you happen to be at annual meeting, perhaps you ran into her, or even a part of her session. So in my role, I work with Janine Fink Boyle and Jody Igor on the nursing home related issues, the assisted living related issues. And my background is primarily in Congress. I spent about 18 years in Congress, which is a fairly long time for congressional staff. Congress tends to have a pretty high turnover rate. And mental note, super important to remember that, because as you get staff turnover, you need to make sure that the staff are newly educated on these issues. I considered it quite the honor, and I considered it an extra tool in my, or an extra arrow in my quiver, so to speak, to say that I would meet with groups annually. And I met with LeadingAge Rhode Island, for example, when I worked for Congressman Jim Langevin for 13 years, first as his legislative assistant, then legislative director, and finally his chief of staff. So why don't we move to the next slide? Now, you guys have heard this. I don't need to tell you why advocacy is so important, but I'm just gonna talk a little bit about the real world impacts and where I think policymakers sometimes miss the mark. In order to properly define like a public policy issue, you need to define the scope of the problem. You need to be able to study those underlying issues. You need to be able to look at them, get impact and feedback from the players who are in that space. You need to develop and implement potential solutions and understand the consequences of those solutions. That part right there is such a key aspect. Understanding the consequences, both intentional and unintentional consequences. And this is very, very relevant to some of the regulatory issues that we are facing, and particularly with the federal staffing mandate. So advocacy is, of course, where you guys come in. 18 years on the Hill, and I never really truly considered myself a subject matter expert. I always viewed the people that I met with as the subject matter experts. You guys are the ones who are living these experiences every day. And your lived experience is invaluable. So it is so important that when we're talking about these issues, that you guys are bringing your experience to bear. You're telling stories. You're making sure that you're imparting the information that you think is most important. And as I'll sort of mention later, that's not to say that we expect you to be public policy experts, but your experiences can help shape policy in massive ways. So Natalie, if we could go to the next slide. I want to talk a little bit about the federal landscape. So what do we have right now? It's not the easiest of situations right now. We have a split government that's highly polarized. Close majorities in Congress, in both the House and the Senate. In fact, the closest majorities that we've had in a very, very long time. And that's made agreement very difficult. We've got a Democratic administration with an active regulatory agenda, as we have seen over the past few years. And part of that obviously had to do with COVID and what was going on in the public health space. But you sort of pull that aside, and we're seeing a lot coming out of the administration in general. Congress, the Senate, as I mentioned, well, we got 48 Democrats, 3 independents, and they make up the majority. So that's 51 to 49. That is a razor-thin majority in the Senate. And we dealt with that last Congress, too. In the House, we're dealing with an equally thin majority. You got 220 Republicans to 213 Dems. In order to pass legislation in this current Congress with the number of vacancies we have, you need 217 votes. And this is for a standard piece of legislation. There are other ways that you can adjust House rules to consider legislation, but just for the purposes of this discussion, 217 to pass a bill. So Republicans have had a really, really tough time passing legislation in the House. Now, some of this has been inter-party with a Democratic Senate and a Republican House, but some of it has also been intra-party. So you have Democrats, on all sides with lots of ideas trying to come together. And then you have Republicans on the other side with lots of ideas trying to come together. But it's been a little bit more visible in the House, particularly with Speaker McCarthy and the motion to vacate. So we now have a new speaker in the House, and that has put a lot of pressure on Congress to get things done. Just as historical, just for some historical context, in the first session of the 118th Congress, which was 2023, last year, only 34 bills were enacted. And I just found that to be kind of a stunning statistic, because on average, over the last several Congresses, roughly 3 to 350 bills were enacted. That's over 2 years. So even if you doubled this, and let's say 68 bills were enacted, that would be the lowest amount of bills enacted in decades. So that really sort of talks about why advocacy is so important. That picture, I hope, sort of demonstrates to you how one vote, or perhaps two votes, in either the House or the Senate can really make a difference. And that's why we need engagement from you guys now more than ever. Can we go to the next slide, please? Now we're going to talk a little bit about the nursing home staffing ratios, something we all love to talk about and have to, quite frankly, because it is looming, it is large, and it is the one of the main topics driving the conversation, and I think will be highly probative to what we'll be discussing come the 22nd, 23rd. So let's rewind back. So part of what has made this such a trying issue is that we came out of the pandemic, or we were still in the pandemic when this administration came in. And back in February of 2022, the president delivered in a State of the Union a promise and an action plan that would address these long-term care issues. And right there in black and white, federal minimum staffing standards. Having worked in Congress for 18 years, I was actually pretty shocked about what I was hearing. That's not to say that I had not heard of staffing standards. They have been a topic of conversation in Congress for a very long time, but it is, for the most part, been in the acute care space. It's been talking about hospitals and not post-acute or long-term care. So that was a bit surprising. In April, an executive order came out on caregiving. Look, some of the stuff was important, but again, another reiteration of the need for staffing mandates. And we got that after waiting a very, very long time in September 2023. We got the proposed rule. November 6th, public comments closed. There were over 40,000 comments. The folks at CMS, at the Centers for Medicare and Medicaid Services, could never get through 40,000 comments. They're going to have to pull in folks from other parts of HHS, I imagine, just to get through all of that. But so when is the final rule going to be released? We have no idea. I mean, realistically speaking, with a president who is very, very focused on delivering on a promise, they may try to push as hard as they could. But if you just look at how long it took for them to get through the proposed rule and kind of the bungled rollout of what happened there, it doesn't look good for them. But we need to inform the process. So if we go to the next slide, quick overview. Hopefully this isn't too new to you, but the mandate, it would effectively replace the existing requirement for RNs on site. 24/7 RN requirement replaces the 8 hours requirement. Right now in the proposed rule, they would have to be on site and available to provide direct care. Director of Nursing Hours would count, and their implementation timeline for this is 2 years or 3 years if you're in a rural area. Now they define rural in a very legislative way by focusing on the U.S. Census and the areas that fall outside of what are called metropolitan statistical areas, or MSAs. We also have new minimum RN and nurse aide staffing requirements. So 0.55 hours per resident day for RNs and 2.45 hours per resident day for nurse aides. Who was left out of this? LPNs. Completely brushed over, omitted, and overlooked, which is a little frustrating given how important they are in the post-acute and long-term care space. Now, there are exemptions that are based on location, good faith efforts to recruit and retain staff, financial commitments, and there are some specifics that exclude you from exemptions. Non-compliance with PBJ data, if you are a special focus facility, or if you're deemed to have insufficient staffing patterns over an extended period of time. Next slide, please. So let's just take a step back and look at the costs of this. We're going, and the number of FTEs we're going to need. Just for the 24/7 RN requirement, we're looking at an additional 3,000 additional RNs. According to CMS, that's about $349 million per year, or an average of 5.9 per resident per day. Now, when you take a step back and look at the minimum staffing requirements outside of the 24/7 RN requirement, so RNs and just nurse aides, we're looking at about 90,000 additional staff that are going to be required. And CMS's own proposed rule states that they anticipate 75% of nursing home providers would have to hire additional staff. And according to their calculations, that would add about $4.2 billion per year across the country. And LeadingAge has done, in partnership with LeadingAge New York and Tim Tate, did some data analytics and really kind of dove a little bit deeper into some of these numbers. So let's go to the next slide. Our calculations don't really align. According to our calculations, we would need 26,000 FTEs versus 12,000. When it comes to CNAs, we would need 85,000 versus 76. And the cost estimates we came up with internally is 7.1 billion in the first year alone versus CMS's 4.2 billion. Now, our estimates used daily numbers and CMS used quarterly averages, but it's a big delta there. And if anything, the LeadingAge estimates are low. Next slide, please. So what are our concerns? Well, I think they're probably the same concerns that you have. We are in the midst of intense workforce shortages and low reimbursement rates. Quite frankly, there are just not enough people to hire. And this is stuff that I don't need to tell you probably. You live this stuff every day. But for the purposes of this discussion, I want to cover the main topics. We need to build domestic and international pipelines of workers. And part of that starts with making investments from the federal government, from Congress. And unfortunately, we were disappointed by what we saw in the rule. Now, the administration did propose, I will say, about $75 million in nursing workforce development money. $75 million back of the envelope. How much does it cost to get a nursing degree? You're looking at about 30 nurses per state. 30 nurses versus 90,000 additional nursing staff. You can see the problem there. We really need investments in our workforce, and we need reimbursements to keep pace with the cost of providing care. As I mentioned earlier, LPNs were largely ignored in the rule, and that is something that we addressed with the administration. We talked about the costs. Where are we going to get these additional wages? And as LeadingAge represents the long-term care continuum, where are we going to pull those nurses from if we don't develop the pipeline, both domestically through training programs and partnerships with community colleges and even high schools? How are we going to address the necessary workforce issues? Additionally, if Medicaid only covers about, on average, 86% of the cost of care, depending on where you are in the country, how does that translate? It really doesn't. The math doesn't work. And it was somewhat disappointing when we saw the rollout. It was, right before Labor Day, and we saw the study, the APT study. It was kind of leaked early, and there was no communication at the outset with the long-term care community. This was just sort of kind of pushed out, and they used the regulatory process to solicit comments, and that is part of the reason why we have so many comments in the Federal Register right now, over 40,000 on this proposed rule. So why don't we go to the next slide, and I just want to talk a little bit about what LeadingAge has been doing in its advocacy so far. So we knew that this was coming. We knew in 2022, and when I joined, we started getting spun up on what it is we could do both in the new Congress and with the administration. And we started early, and we really wanted to make an impact. So in January of last year, we sent out an action alert. Natalie mentioned action alerts earlier. They are such an important tool in our toolbox to engage with policymakers, whether they be in the administration or in Congress. So we sent an action alert out to all of our members, and I'm very happy to say that we got over 1,000 messages generated to the CMS administrator, to that email address. So 1,000 messages from us alone saying, hey, we cannot handle minimum staffing standards without adequate workforce and reimbursement solutions. In February, after a lot of our state execs had a conversation and our policy team got together, we put out the Get Real on Ratios proposal. And this was essentially to get a proposal that said we need higher Medicaid rates, we need higher Medicare rates. We need to make sure that managed care keeps pace with the fee-for-service rates. You can't have workforce shortages and impose a mandate. It does not. So there need to be proper exemptions in place in that. And it needs to take into account local public health conditions, such as the pandemic that we were in, as well as things like snowstorms, hurricanes, and other emergency-related situations where it may not be possible to staff at those levels. So it was an important part of the discussion. And I'm happy to say that our meetings with a lot of congressional leaders and committee staff, we met with Senate Aging Committee staff, we met with the Senate Finance Committee staff, and we met with the Senate Health, Education, Labor, and Pensions Committee staff, Senate Help. And then on the House side, we met with the Ways and Means Committee, which has primary jurisdiction. They're sort of the equivalent of the Senate Finance Committee in the House of Representatives, as well as Energy and Commerce Committee, et cetera. So we engaged with Congress, the congressional leaders, and we also engaged with the White House directly. So we talked with the White House, including the Office of Management and Budget, that has to clear all of these rules that sort of come into play. And we did it in June. We were waiting for the proposed rule to come out, and when we realized that wasn't happening, we took advantage of the opportunity to engage with the White House on this specifically. So lots of engagement on both the congressional side as well as the administration side. Next slide, please. So let's fast forward a little bit. We also, I mean, we held a workforce related briefing in Congress in August. So we were doing our best to get ahead of the curve and make people understand why a staffing mandate would be incredibly difficult with where we are currently. With regards to our workforce and with regards to the long-term care financing system or lack thereof in the that we have.
Todd, I did have
I,
there was a question real quick in the
I
chat. I don't know if now's a good time or
yes,
if you want to do it.
absolutely.
Or I can even read it to you. It says, from
Yes,
Michelle, is the Medicaid program being threatened like Social Security, or is there confidence that the program will continue indefinitely?
that's a great question. So the I think the short answer is yes, Medicaid is being threatened, but not in quite the way that we've seen Medicare or Social Security threatened. A lot of what policymakers want to do to limit the impacts of Medicaid funding on the administration is change it to a per capita cap type of a system. So that in and of itself would be incredibly problematic. When I worked for Congressman Jim Langevin from Rhode Island was the first state to implement a global waiver. And I was privileged to be a part of some of those conversations. And it was kind of funny because as some of my colleagues, colleagues, my staffers that worked in other offices for other members, they started talking about, oh, well, this is a block grant. Rhode Island is actually showing how a block grant can work. And I had to be the person that told every one of them from, across committees and member offices, this is not a block grant. It's a global waiver, and it is very, very different than what it is that you're talking about. So is it being threatened like Social Security? Not so much, but we need to stay on the ball and make sure that our members of Congress know that a Medicaid block grant or a per capita cap will be incredibly difficult and it will shift costs to states. How are states going to spend more money if they're not getting an FMAP increase or a federal medical assistance percentage increase from the federal government? So it's a great question. That's something we want to keep an eye on. But so far, we have been successful in staving that off. If any other chat questions come up, I will try to keep an eye on that. So we and by we, it's the royal we. I could not have done most of this myself. Thank you to Janine Boyle, Jody Igor, as well as all the other members of our policy team. They really worked hard to set up webinars and really try to inform folks on how to comment during this process. We also sent out additional action alerts. And in fact, in November, at our annual meeting, we had 3 days there where before the rule closed for comment. And we ended up getting 530 comments over to the Federal Register in 3 days, which is fantastic. To be honest with you, I can't even count how many comments we solicited because folks did it as part of our Action Alert network, but they also sent their own emails. So we have, a ballpark, but we know that a good amount of those 40,000 comments came from LeadingAge members, which was great. We also continued to work with Congress. Now, the appropriations process, the federal funding process for discretionary funding, is a tricky one. In fact, Congress is up against a January 19th deadline, as well as a February 2nd deadline to extend that. And you may have seen that there is an agreement that has come about between congressional leaders, but they're really going to have to shop it around to their members of each conference to see if they have the votes to pass it. So stay tuned on that. But as part of the more robust appropriations process in funding the Health and Human Services Department, we worked with Representative Greg Murphy from North Carolina, who put forth an amendment that said, no funding shall be used to implement this rule. It's called a limitation amendment. Now, I am very, very happy to say that through our engagement and through the hard work of a lot of other partners, coalition members, the amendment was adopted. The bad news is that they ended up having to pull the bill because they didn't have enough votes to pass it. So it was adopted, which is important. It's a signal to the administration, but it is not contained within the legislative language. So we're going to keep working on that. Let's go to the next slide. And then finally, again, after the proposed rule, we have been working and I have really been trying my best to get our state partners engaged and organized and feeling more comfortable with having either virtual or in-person lobby day visits. Hopefully our leadership summit and lobby day that we hold in the spring is not new to you. But those tend to be a little bit more broad and allow folks to kind of talk about issues across the long-term care spectrum. In this particular case, we want focused advocacy, and you guys are helping to do that with the day that is going to be coming up on the 23rd. So hopefully we'll get state folks, but we'll also get federal partners. You guys have 5 members of the congressional delegation, and they have been fantastically active, in large part thanks to the work that LeadingAge Nebraska has done, what you guys do. So even though I don't have LeadingAge Nebraska on here, I only have the ones that we have done in Washington, D.C. We have managed to hold over or almost 40 meetings with 40 different congressional offices and counting. That does not include the meetings with additional staff. Okay, next slide. So let's talk about the bill that we are really kind of honing in on as it relates to the federal staffing mandate. And that is the Protecting Rural Seniors Access to Care Act. I love how these bills are always such a mouthful. So the bill numbers do not really correlate to the bill numbering process in the state legislature. So in the House, HR stands for House of Representatives, not House Resolution, and then S just stands for Senate. So September 29th, we had Michelle Fischbach introduce, sort of partner with Greg Pence from Indiana, to introduce this bill. And what it would effectively do is it would prevent the proposed rule from going into effect and instead establish a workforce advisory panel on the nursing home workforce shortage. It has gotten 27 co-sponsors in the House. And then on December 6th, I am happy to report, if you don't already know, that Senator Deb Fischer from Nebraska took the lead in introducing this in a bipartisan way. The House bill, right now, it's all Republican. We have been trying very hard to work with our state partners to get Democrats onto the House bill the way they introduced it in the Senate. It's been a little tough, though, because we have a Democratic administration. It puts a little bit of pressure there, but it might be something that sometimes they want to do as a group. So if they're going to do it, perhaps you get a couple of them jump on. But the Senate bill was really a bipartisan effort. We had Fisher working with Roger Marshall from Kansas, James Langford from Oklahoma, Tester from Montana, a Democrat, Kirsten Sinema, an independent, etc. So this bill is one that we are trying to educate members on. That has been a big focus of our congressional visits, both virtual and in person. And I even put a link in the slide deck, the red link, where you can click on the action alert to write your member of Congress. We are hoping that we're going to continue to share this action alert in the coming weeks, but the more that we can engage on that, the more we can lift up those numbers and make sure that our members of Congress are hearing from us, both in person on the 23rd, but also via these action alerts. They are so important. Let's go to the next slide. And let's just talk briefly about the policy toolbox that we have at our disposal. I hope that our policy update calls, which happen every Monday and Wednesday at 3:30 Eastern, 2:30 Central, are not a new announcement. We started them during COVID. They were every day for a while, and then as the public health emergency was unwound, we changed it to a general policy update call. Now, I know you guys are busy, you're multitasking. I know that well. And so I understand that you may not be able to join, but if you would like to, you can feel free to click on the link in this slide or just shoot me an email. And I will be happy to send you the link to register for those calls. You'll get alerts when they're about to happen. You can join or not, but it's an opportunity. We have a featured speaker every call, and then we go through a rundown of the latest policy updates that are going on across the care continuum. Member networks. We've got nursing home member networks. We've got life plan community member networks, home health member networks. They are generally monthly, or sometimes they have a faster cadence, biweekly, etc. And they are a great opportunity if you just want to hear what's going on in a particular service setting, and if you want to ask any questions. It's informal, and it's really a great opportunity for us to hear from you. We already went over the action alerts, but I did link the slide to our website in case you would like to see them. We also have a service coordinator alert that has to do with basically authorizing more service coordinators in affordable senior housing, in addition to our Protecting Rural Seniors Access to Care Act action alert. I mentioned Lobby Day, which is coming up April, I want to say it's April 17th. It is the last day of our leadership summit, as well as additional in-person visits like the Nebraska breakfast. So great opportunity. We've also been trying to help folks set up visits with their members so that they can have more intimate discussions, and members of Congress in both the House and the Senate have an opportunity to visit perhaps a life plan community or a nursing home. That is a wonderful, wonderful opportunity to engage them and to show them firsthand what's going on at facilities, having them talk to residents, staff. So we put together a little toolkit called Congress in Your Neighborhood. And if any of you are interested, happy to send it along to you guys. It gives you just a few pointers on how to do it the best way, but you guys are already on top of it with the breakfast, so that's fantastic. Additionally, letters to Congress and the administration. You don't necessarily have to wait for an action alert. We're encouraging folks across the spectrum to write to their members or get together, with either LeadingAge Nebraska, et cetera. There's already been some work done on that front over the last year, which has been fantastic. We work with a broad coalition of folks, both at the state level as well as at the federal level. And the more we can bring folks into the conversation, the better. And then we have our grassroots and grasstops organizing. So let's go to the next slide. which is just a little bit more of a practical response to what you can do to influence policy.
What
Tell us
exactly
what's on
do
your
you
mind.
mean by grass tops, Todd? Grass
That
roots
is
and
a
grass tops.
Exactly. That is a fantastic question. And that's one of the reasons why I fast forwarded to this slide, because there is a bullet, third from the bottom, identify grass tops connections. Those are members of your community who know legislators. They are effectively people with relationships, pre-existing relationships with members of Congress, or perhaps with your senators, your state senators. I was on a prep call not too long ago, getting ready for some Hill visits, and one of the uh, 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 one of the folks who ran a nursing home said, "Listen, this member of Congress, their father is actually in our facility. So I need a little more information because I have an opportunity here. I have an in, and I might get a call from that member of Congress directly saying, hey, you know, I am concerned about this. I'm concerned about it from a practical perspective, but I'm concerned about it from a policy perspective. So and that was brand new information to me. I didn't even know that that relationship was there. So that's always a really helpful thing to know and a thing to keep an eye on. If you hear from one of the staff that you work with at the at the state level or the federal level, and you hear them say, "Oh yeah, no, they were a geriatric nurse before they came to Congress." Representative Kiggins from Virginia happens to be a geriatric nurse practitioner. Or if you know someone who is, connected to a member of Congress in a facility, it really brings everything down to reality. It's where policy and reality meet. It's where the rubber meets the road. And that really helps contextualize things for them. And that's why your engagement is so important. So, as I was saying, tell us what's on your mind early and often. The more we hear from you, the more insight we have into what's going on in your state, in your community. And that is always helpful to us. And we're always happy to answer questions whenever possible. Respond to action alerts, of course. Don't have to beat that drum too hard. Come to Leadership Summit if you can. Again, I understand you guys are busy and that becoming an advocacy champion, it takes a lot of extra time. We try to make it digestible and easy and certainly at your own convenience, but the more folks we have engaging, the better. So virtual or in-person meetings. And then as Natalie said at the top, tell us about you guys and what you're going through. When they hear about workforce problems, and if you happen to have, a chief financial officer or a financial analyst who can tell you, listen, this is where we are, in terms of what's coming in. This is how much we can flow. This is the razor thin margin. Share that if you can and if you're comfortable. If you're having to reduce your census, McKnight's long-term care had an article today about this very issue. And I was very pleased to see Kirsten Reed mentioned in that article. But the reality of what's going on, 15% of nursing homes closing in the last 5 years, that's bananas. And that's the kind of information that really helps paint the picture for the folks that we are trying to influence. We are in the process of at LeadingAge National, we are in the process of sort of ratifying our policy platform. So there will be a more robust conversation about what workforce solutions we can help propose as legislative solutions. But broadly speaking, yes, they are building the pipeline domestically and internationally, and finding creative solutions wherever we can, even if it's a pilot program that we can speak to and get it scaled up in some way. There are solutions out there. We just need to make sure our members of Congress and our state legislators know about them. So that is my spiel. I hope I didn't bore you too much, and I'm happy to answer any other questions that you guys may have, if you have them. And if I can't answer it, I will find that answer and get back to you by email. And if there are no questions, that's fine too. But please don't be shy.
So I have a question, and maybe this isn't the right platform to ask it. So just say, nope, not me, not it. So it's like we have these different buckets, right? We have, how are we running? So my name's Michelle. I previously worked in long-term care for 7 years, and I'm currently a coach consultant, and I work with families and then also help support team members so that they are nourished and reinvigorated. So they want to go to work. And then also I will be an adjunct professor of the long-term care administration class at one of the local universities in the fall. So that's me. So when we're coming at this from all these different angles, we obviously have how are we staffing our buildings is top of mind for everybody. There's also just this cycle that we're currently in that I feel like I experienced being in the building, and as I'm working with clients, of there's so much fear around long-term care, and then all of this is really just fueling it and perpetuating it, and people wait so long to make that decision, to make that transition to long-term care out of their homes. I guess what is my specific question is, is that something that you feel needs more attention? Just the cycle of caregiving, that the ups and downs of that, and the trajectory of family members as caregivers. How are we really supporting families to help them feel like long-term care is an option? And then obviously there's paying for it, but also just that emotional transition. Like people just wait so long to make that transition, and it's really at the detriment of the caregiver and the senior. So I think there was a question in there, Todd, if you could weed it out, but just from what you have experienced and your breadth of knowledge and wisdom, kind of where are we with that piece of it?
Mm-hmm. It is actually a very, very good question. And it is a relevant question because we are dealing with a proposed rule on minimum staffing levels because of the genuine fear and, dare I say, the way long-term care has been painted. And that's part of why, that's the other part of why I think advocacy is so important, and sort of developing relationships with members and staff, and getting them to come demystify it with visits, because it is so, and this goes back to actually my first slide, why is advocacy important? Advocacy or policy, I should say, is often created in a bubble, and very much so in DC. We like to think that we get input. Goodness knows we try our best, but a lot of people see headlines, and they saw headlines during the pandemic. There are still headlines out there that are scary, and it's, hey, this many people died during the pandemic in nursing homes. This happened in this state. This happened in that state. Oh, why isn't there enough staff? We need to protect our family members. But that is usually coming from the perspective of people who don't know very much about the issue. Or they want to tackle the most direct threatening issues, the ones that are rising to the top. And when you see these headlines, they're scary. You read the articles, they're scary, but they're not representative of every community. They're not representative of every care setting. And part of that, I think a couple of my colleagues, both in the workforce as well as in just the care setting space, would say is we need to get people engaged earlier. They need to understand And the earlier the better. That's why I alluded to when I was talking about workforce solutions, programs that link high schools with long-term care settings. I will admit, just pulling from personal experience, my parents are in their 80s and 90s. I am very blessed that they are cognitively sharp, physically capable of living at home still, but they watched their parents go through really, really challenging issues. And that was informative to them. So they decided to get long-term care insurance. Now, they didn't get it publicly because it doesn't exist unless you want to go on Medicaid and et cetera. But we don't want folks to impoverish themselves. We want them to be able to have access to quality care. And part of that is also developing a financing system, a public financing system that is sustainable and effective. And it also speaks to the importance of, increasing the reimbursements. But to get to your point, I think that we can help demystify and counter some of the fear that's out there in the news, and it's there all over the place. I mean, I have a panic attack pretty much every time I open the newspaper because some other horrible thing has happened, and oh goodness gracious, what are we going to do about that? It's very easy to internalize it, but if you're coming from a perspective of, hey, I've been to a skilled nursing facility and I did not see that. Let me give them a call. Let me give Michelle a call. Let me give Natalie a call. Let me give Jeanette a call. Let me see what's going on there. So I can get an on the ground sort of perspective. I can see it for myself. Then you start to see more understanding. So I think, yes, we're countering a narrative that has to be addressed in the press. It has to be addressed in government. It has to be addressed in the private sector and the nonprofit space. So it's a very, very valuable question. And I think it all comes back to engaging people as early as possible.
Great, thank you.
No, thank you for all the work that you do. I wish I had a coach who could buoy me up a little bit from time to time because we're climbing a big mountain.
It is a big mountain. My own little, I'm going a little rogue this year. Part of my initiative is I want to make little reels on Instagram about 50 different senior living communities. I've already got like 3 or 4 out there, but I just want to push one out a week. And then I'm going to start collecting stories. I've already had 3 or 4 videos submitted to me from frontline team members about why they love their job and why connecting with the residents is so meaningful and impactful to them. So I'm really I guess that's a grassroots initiative to really infuse enthusiasm for this line of work because it's so powerful and uplifting.
Absolutely. And that's a great example of ways that we can educate people. I'd be very interested to stay in touch with you on that. If it's okay to see how it goes.
Yeah, I'm on LinkedIn.
Okay, great.
Yeah.
Then I will make sure that I either find you or if I for some reason I can't on LinkedIn, I will go to Natalie or Kirsten
Yeah, they
make sure
got
I
me.
get the right. Okay,
And I'm
great.
just going to say,
Fantastic.
Michelle, tag me or tag LeadingAge Nebraska on that too, because those sound
Okay.
awesome. Yeah.
Yeah, that's another way. Listen, I mean, I try to do my own little part. I don't have that many followers. I'm not the biggest social media person, but I try to kind of socialize what it is that we're doing at LeadingAge National and some of the work that we're doing with our state partners. So, to the extent that I can, share that stuff. It's a breath of fresh air in an otherwise very kind of stale space that we've been living in.
Yeah. Thank
Yeah,
you.
the more we can all share those action alerts. I mean, those are we're getting the word out. So yes, share them with people, even if they're not in LeadingAge, LeadingAge members. It's okay. Get those out there. Get the information out there. We need more people talking to our legislators. So
Absolutely.
yeah. Anybody else?
Thank you, Todd, for all you're doing. to infuse every state. That's a big hill, and we're holding the rope with you. We're here.
Yes. Yeah. Hey, listen, it's thanks to you guys that and you know our collective work with Senator Fisher that we have a bipartisan bill that really speaks to what you know our concerns. And you know she did a wonderful floor speech. This is a partnership, and you guys give me, you know, talking to you guys, hearing about what's going on, it really kind of empowers me and gives me the energy to go back, hopefully with you guys as partners, to really kind of tell these stories and make sure that we are influencing policy in the best way possible.
Absolutely. Thank you, Todd, and thank you everyone for being here. Todd will be here, like I said, on the 22nd in Lincoln at Eastmont, from 4 to 6, and then we'll have our social hour from 6 to 7, and then we have our breakfast on the 23rd. So please put that on your calendar. Free for our members. So we want to encourage as many people as possible to be there, spread the word. And thank you everyone, and have a great day. Stay safe out there on the roads.
Thank you.